You are listening to Love Your Practice with Dr. Laura Mock. I'm a general dentist, a practice owner, and a certified life coach. I teach women who own dental practices to lead with intention and literally fall in love with their businesses. Keep listening and you will see how learning to love your practice turns into loving your life too. Hey ladies, have you ever been in the middle of a clinical day when your assistant or your hygienist or someone who works for you does something that you want them to do a little bit different, or maybe a lot different? Maybe you're a little bit irked or you're furious. Either way, I have felt the pain of being in the middle of taking care of humans and not being able to take the time right then and there to be the manager as well. And then what happens typically is we get to the end of the clinical day and we still haven't talked to that person about what we want them to do differently. And there's two reasons for that. One is because we really are busy. We really are. But the other one is that there's reasons our brain will give us not to have that conversation. It's uncomfortable. And we don't know exactly what we're going to say or how we're going to do it. We don't know how to have a conversation about positive changes that don't turn frustrating for the recipient or for us or both. And the thing is that I have had so many clients come to me and complain about this problem that I have actually made a course just for you female dental owners, and it doesn't cost anything at all. I made it for you for free. It's deeper than I can go in just a podcast. So what I did was I put the whole course together in a little online bundle, and all you do is text me to get the course. So I have this number set up. It's 66866. Such an easy number to remember. And you just text the words "love your employees" to the number, but you can't leave any spaces between the words or it won't come back correct. I don't know what you'll get if you leave a space, but so your autocorrect will want you to leave spaces there. You got to go back in and delete the spaces. Love your employees to 66866. And the next time someone does something in your practice that you want to change, you will have a very easy system that smooths out the speed bumps that our brain wants to put in place for us to not do the thing. But trust me, I have helped many women do this before. It's a tried and true plan. I use it myself. Text the number, and then I'll see you in the course. Hey ladies, happy summer. Dr. Laura Mock here. Welcome to another episode of Love Your Practice. Today I interview the amazing and influential Dr. Maggie Augustyn, and she is just taking the field of dentistry by the storm lately with her vulnerability and her wisdom. Give a listen to this episode with this interview. You will not regret it, and you will definitely come away uplifted and feeling ready to take on this day. Okay, I would like to welcome to our podcast today, Dr. Maggie Augustyn. Thank you so much for joining us today.
Thank you, Laura. How are you today?
I'm amazing. It's sunny. I already did my bike ride, so I'm my knee has not been allowing me to run lately, so I've been biking instead, and I think I like it better.
I love biking. I used to bike to work almost every day, back and forth for a couple of years. I haven't been able to do that as much, but my bike is downstairs. The tires are ready to go, and I am at some point I'd like to take a bike ride almost every single day.
That's amazing. I didn't know we had that in common.
See?
You have really good trails in Chicago?
Yes, we've got a couple that are just surrounded by trees, and I need green in my life. And the shade and the smell and the tiny little critters that go across the trail. Yeah, it's just heaven.
I had an Oriole fly right in front of me this morning. It was amazing. Yesterday, I saw indigo bunting. Do you know what those are?
I don't.
Teeny tiny little electric bluebirds.
Wow.
I'm kind of a bird dork.
That's okay. I love watching birds. I'm not a bird watcher, but I find them fascinating.
Yeah. Well, okay, let's get to the topic here. So Dr. Augustyn is a dental practice owner. How many years have you owned?
17.
Wow. 17 years. And she's also just like a general badass. Is it okay if I call you that?
Thank you.
We say swear words on this podcast.
I love that. Go for it.
They kind of go flying sometimes. But yeah, before we get any farther, I would love to get like a little bit of a background from you on how you got to your badass self now. So back from before you were badass, I want to hear about maybe what was happening in your journey in owning the dental practice that kind of like turned your bus into the direction that you're going right now.
Thank you for asking. So I graduated dental school and I had 2 failed associateships. The first one I was working for a fee-for-service practice. It just did not work. It was really cliquey. And the second one, I started working for a DSO back even before DSOs were around. And there were points where I would come to work and we would be out of slow speed sections, or they would re-sterilize sterilization bags and staple things together. And there were a few times that I just walked out because I said I could not work in that environment. And I knew that it wasn't going, I couldn't survive very long. That was about 18 months after graduation.
Mm-hmm.
And I did not fit the mold of being an associate or working for a DSO. I'm too much of a maverick. I'm stubborn. And so I wanted to go into having my own office, but I was trembling at the financial commitment. It just scared me so much. And I asked everyone I knew if they would be willing to go into a practice with me because I was too scared to do it alone. And everybody said no. Truly, almost every person that I knew that I graduated from dental school that I was close to said no. But the person that I was working with at the time, he was also thinking that he was going to leave that associateship, and he decided, and I asked him, he was the last person that I asked, and he decided that, you know, he was willing to go into that commitment with me. And it's funny because I remember meeting with him prior to us signing the dental work and how all the paperwork, and telling him, there's something you have to know about me. And I have a mental disease, and I have depression, and sometimes that gets in the way of me functioning. And so he was very accepting of it, but I wanted to put that on the table right from the beginning. And so in the 17 years, the practice that we bought was predominantly HMO. We added public aid to it, and it was an extremely difficult journey. I mean, I wanted to offer the services to anybody and everyone, but patients seemed less grateful than I needed for me to fulfill my own purpose. It just really, I was working too hard. I was working too much, and there wasn't a reward on the amount of work that I was doing. All I needed was for someone to appreciate me, and I never got that. And so COVID happened. But before COVID happened, 2018, I was diagnosed with cancer. And then after that journey, I decided that I did not want to go back to the hell that I was working in. And 2019, 2020 came, and that gave me an opportunity to really figure out where it is that I wanted to go. And that's when I started to work with Productive Dentist Academy in turning my practice around. And it was a lot of work over the last 3 years.
Isn't it? It's like practice is like a cruise ship, like a big one going in direction.
Yeah, it could
and
be.
If you wanted to like turn, you're gonna have to like take all the engines and be turning the water a different way. And then practice really wants to keep going the direction it was because of all the systems and the habits and the people and the patients and everything. And did you still have a partner when you decided you wanted to change?
Yeah,
Same partner?
Yes, we're still together. But he liked the way we were. Just like all of us, he was reluctant to change, right? He was fearful of the change. And so was I, but I just did not want to settle anymore. I didn't want to lead the kind of life that I did before. And so, yeah, you're right. All of that was extremely difficult. I was very, very, very lucky to have an incredible team at work and really a tremendous amount of support at home. You know, working 12-hour days. I still work 12-hour days. By the end of Thursday, I'm usually at like 36 hours or 40 hours that I work. And it ends up, and it takes away from your ability to find joy. And so within the practice, you have to find things that fulfill you. And if you don't, it burns you out, right? And you end up just, I don't know, lacking the sunshine that you need to get up in the morning.
I mean, once you feel burned out, I don't know about you, I just don't give a shit anymore.
Yeah.
I'm just like, I don't know. When's my lunch hour? I'm exhausted. Oh, yeah. My bottle of wine is in the fridge waiting for me. Is it time
Yeah,
now? Well, would you say that
exactly.
this desire for change, was it influenced at all by the COVID shutdown and just being like all of a sudden out of your environment?
I think for a lot of people it was. COVID was an opportunity for us to rest and rethink. For me, whatever COVID did for others, cancer did for me. So for me,
Mhm.
that initiation of needing to change, of wanting to change, and being unwilling to settle
Mhm.
was going through the journey of cancer, the way that it affected me and my family, and the trauma and that comes along with it.
Did you have cancer during COVID or before COVID?
Before 2018, and
Okay.
then I had surgery late 2018.
Okay.
Um, I didn't need any chemo and radiation. I was given a choice between chemo radiation and surgery, and I chose surgery. And so in November 1st is my 5-year checkup. And if that test comes back clear, then I will be in full remission and cured, and I am going to have a party. If that's
I'm marking my calendar right now.
yeah,
That's really exciting. Congratulations on that,
thank you.
getting to this point. And so you had some hard things happen. And during the hard things is when you realized you needed a career change. Not that you didn't want to be a dentist anymore, but you didn't want to be in the practice the way it was right now.
That's right. Yes.
And is this around the time that you started being more vocal on social media? Because I remember when you started popping up and saying a lot of comments on being very vulnerably about what sucks and how
Yeah.
you're feeling and being very honest with people. And I think that everyone was like, wait a second, someone's being honest about how much this career sucks. You know what I mean? And so it got a lot of attention quickly because you were so vulnerable and open about what was happening.
Yeah. So I wrote an article January of 2020 called Dentistry Made Me Hate People. And I remember, sorry, I didn't mean to make you spit out your drink.
I almost spit my coffee out, ladies. But okay.
But I remember getting a call or getting an email from the editor. Like within an hour of its posting, it had 1,000 views. And so there used to be a little counter on Dentistry Today. They've removed that since, and I can't seem to get the number. But the last time I checked, which was a couple years ago, it was at 17,000 in terms of how many people had read that article. And why is that? Because it is true. Dentistry does make us hate people. And I remember having somebody in my life that was a quasi mentor telling me, are you sure you want to publish this article? This article will end your career. This article is wrong. And if you publish this, you're going to be known for this article and not in a good way. And this is a dentist that has, that's I think in his 60s, maybe 70s now, giving me this advice, and it made me scared. This was a successful, very successful dentist who kind of sort of took me under his wing and was giving me this advice, and I had to think about it 10, 20, 30 times. Do I really want to do this? But in the end, it is who I am to start talking about this stuff. Yeah, dentistry makes us hate people because people can be real assholes. And whether it's the people that we associate with, like the people that work for us, or patients, we can be assholes too, right? Like we're not removed from the equation. But that's really when it started for me. That's when my voice became clear, and that's when my purpose in terms of what it is that I was going to be saying on social media or just wherever I was at, that is what I was going to talk about. And my internal purpose, my internal compass, is to talk about the things that people are even afraid to think, so that nobody feels as alone as I did. you know, in the last 40 some years.
So it sounds to me like your purpose is to try to help those who are in the dental profession to feel like maybe understood and not alone.
Yeah, relevant. I think one of my biggest triggers in terms of, suffering from emotional distress is feeling irrelevant and invisible,
Mhm.
and of course alone, right? And so I think that by talking about the things that nobody really wants to talk about, you not just feel less alone, but all of a sudden you stop being invisible.
Mhm. Yeah, that's really fascinating. So now you said you still work for like 10, 12 hours days?
I do, yes.
Okay. And then in addition to the dentisting,
Hmm.
you are reaching out in different ways. You're speaking, you have your Instagram. What else? What's happening?
My true passion is writing.
Writing? Okay, yes.
Writing, I have a column called Mindful Moments in Dentistry Today,
Mhm.
and it's one of the first columns that Dentistry Day has ever had. I was extremely fortunate to connect with Paul Feuerstein, from the editor-in-chief from Dentistry Today. He really welcomed me and he allowed me to have that platform. But writing for me, it's everything to
Mm.
me. It is a way that I have of processing the things that are kind of blocking my chakras. I don't know, the things that are making life so heavy.
Yeah.
Um,
Yeah. So a lot of writing too.
yes,
Okay. And then you do pop up in different social media groups where you lend support where and when you can. Yeah.
I do. I have a conversation almost once a week with
Mm.
some random person I've never met,
Mhm.
trying to either, talk to them about my practice growth or just simply encourage them. It's really interesting. I do get ketamine for my depression and suicidality, and I can't tell you how many people in the dental field reach out to me to ask me about ketamine. And
Yeah.
I was one of the first patients in Illinois in 2018 to receive IV ketamine.
Mhm.
And so I tried to lend support to people that way by telling them about my experiences and how, I feel saved as a result of that.
Mhm. So one of the things, and I think I already mentioned the word vulnerable, is that you have taken a risk to speak the truth about hard things that maybe other people might have tried to hide under a blankie or just pretend everything is perfect, you know?
Mhm.
And when you talk about mental wellness, when you talk about having cancer, when you talk about hating people, it's like you're giving a voice to all of these feelings that we all feel embarrassed for having.
Yeah. And I feel embarrassed for having them too.
Mhm. And yet you share them because your desire to, like we said, connect and to help people not feel alone is greater than your desire to hide it.
Yeah, I'm tired of hiding it. I think we all are.
Yeah.
It's just so hard to keep on pretending, right? As you don't, we all know this, whether you're a dentist or a practice owner, you go into the practice and it's showtime. You
Mhm.
cannot go in there and you know, you cannot indulge in your depression.
Mhm.
You have to be upbeat and positive with your patients,
Your
right?
patients
So
need you to do that. They need to
they
know
do.
everything is great. You can't
Yes.
go in and go, well, my depression's got me down today. Thanks for
Yeah.
asking.
Yeah.
It's,
So
I'm great. How are you?
yes, that's exactly it. Yeah. We do that. We do that with everybody. And it's funny because, I went to a family gathering recently and I wasn't well. And was going to get ketamine a couple days after. And my dad comes up to me. He's like, "You just seem great." And I said, "Yeah, I've had a lifelong experience of having to pretend." Well, you end up needing to be the person people expect you to be. They expect, right? As a dental practice owner, as a dentist, your patients expect you to be a certain way, and that's what you got to deliver. And that's where you know,
Mm.
that's where pretending comes in.
Yeah,
But then once you get home, you hide in the closet crying because that's when your true self comes out
because you're exhausted from pretending.
from pretending.
You know, I want to expand on that a little bit because I think we do the pretending when we're leaders as well. In our leadership role as the owner and the CEO and the CFO of our practices, there's some pretending that we as women especially do because we've been taught by the time we're like 2 or 3 and the adults around us go, oh, you're so cute, you're so nice, we get this message that we're making the people around us happy by being adorable
Yes.
or agreeable, like they
Yes.
tell us that when we're having our little toddler tantrums, right, and
Yes.
getting our feelings out. And so then we pretend like everything is fine with our employees as well. And if there's a thing that someone is consistently doing that we don't appreciate or that isn't part of the job description or whatever, a lot of times we're so used to pretending, we don't even realize that we're putting up with mediocrity or just like not solving a problem that's completely solvable, except that we're exhausted and still pretending until we're so tired of the bullshit that we raise our voices or react in a way that we didn't intend to. We lose our temper, and then we get a reputation for being crazy. I mean, did you ever hear, oh, you worked for a woman dentist? I hear
Yeah. She's a bitch.
she's a bitch. And part of that is because we hold it in and we hold it in and we hold it in until we can't stand it any longer. We were trying to do it so that we would be that person that we were supposed to be when we were 2 or 3 and people were happy because we were being cooperative or whatever.
Yeah.
We don't learn as women how to say what we want in a way that's collaborative and curious and strong unless we've stepped out of the indoctrination that we received.
But I will tell you, even if you do develop leadership skills, and even if you do choose to be strong and do the right thing for the right reason, even if you step out of that patriarchy and the way that we were raised, regardless of how strong we become and how much of a leader we become, if you insist on something and if you make a rule that isn't popular, despite you being a good leader, you're still labeled a bitch.
Yes.
And at least that's what I'm experiencing. I've put up with a lot of mediocrity for a very, very long time. And again, 3 years ago, it all changed. I am going to be a leader, but at the same time, I have to hold people accountable for the rules that need to be followed. For example, I mean, silly things, they're not silly, but some of my employees do not undress or take off soiled scrubs, right? OSHA regulations. Some of my employees want to have really long nails, chairside clinical, and I am stern about keeping that rule. And if you come in with long nails, I will make you go home, or tomorrow you need to come back with shorter nails. And I'm to the point about it. I'm not gonna. What's there to sugarcoat? You've got long nails. You received the office manual. You can't have long nails. You got to come back and have shorter nails, or you got to change out of your scrubs. I'm a bitch.
But you know what, Maggie, is that what I've found is that there are your people, your employees, like your team. There are people who think you're amazing and who want to follow your leadership. And there are other people who just don't.
Yes,
And they need to get off of your bus.
they sure do.
They can't stay because they don't care. They don't believe in you enough to go the extra mile. And when you see them doing things like disobeying things that are clearly trained as not acceptable, that's like them telling you they don't want to work for you anymore. And we were talking about this yesterday about how there are people who choose you, and those are your people.
They are. And it takes a minute. It takes a minute to find that. I was talking to a friend of mine the other day, and this happened to me too. you hire a hygienist, and it doesn't have to be a hygienist, it could be anybody else. And once they're offered a job, they use that as a leverage to go back to their primary employer and say, hey, I just got a job for this much money, you need to match it. And of course, they accept the job and then they don't show up for the position because they ended up using you as leverage. And it sucks and it
Mhm.
hurts. And it, it's really hard. It takes a minute to get over that, because you got to go back and you got to re-interview. And this is the emotion and the feeling that you'd been left with. You know, I hire someone, and what do? They use the goodness of my heart, the generous package that I have to offer them to work under my wing. They use that as leverage to take advantage of me. And so that is definitely a person that you need to look up to the sky and say, thank God this person didn't accept the job with me because I know who they are, right? But finding people who choose you, it's not, it's just not easy.
It's not easy. And I feel like we live in fear that we won't be able to find our people. And so we put up with who's already in the chair on our team, you know, and it's happened to me so many times that I put up with it and I put up with it, I put up with it. They quit. That's usually what happens. And once they're gone, I'm like,
Ah, I can breathe now.
I can breathe. This is better. This is so much better. And then I'm always surprised at what the universe brings. Maybe it's another person, but maybe it's a change in how we operate, you know, where we realize that we are actually fine without that person. We had some big changes about a year ago, and I told myself that I wasn't going to be able to replace who was leaving. And so I made the last step towards becoming fee for service. I severed the last contract and I started telling the patients, you're going to pay us and then you're going to go home and your check will come to you. And so now I did. There are people that I did not replace, but at the same time, my practice is way more profitable than it was
Yeah.
before. And I'm having a better time because
Yeah.
anybody who didn't care, if they care more about their insurance than they do about
Right.
me
The
as
care that you
a
provide.
practitioner,
Yeah.
they left. And so I have this highly concentrated group of patients who adore me.
Mm-hmm.
It's like the best. And so, yeah, I was afraid of the change that would happen if so-and-so left the practice and then it happened and I was actually better off. So I want people who are listening to this podcast to ask themselves what they are afraid of and
Mm-hmm.
decide if that's something that they really want to continue to protect and hold over their own practice satisfaction.
And I often disguise that feel. So you know who's toxic, you know who doesn't belong. You know that, you just do. But then you kind of find reasons to not believe it, right? And so in my head, what I end up doing is I end up just thinking about the person as a human being and just give them endless chances over and over and over and over because I care about them as a human being. Except it just creates so much distortion in the team dynamic, by giving this person a chance over and over. And my PDA coach told me one time, by giving her so many chances, aren't you removing the possibility of her actually learning something else somewhere else? What are you doing? You're constantly giving her a pass. So I had two employees like that recently that just were so toxic, and they were creating this wave of drama in my office, and I put up with drama. And one of them we ended up letting go, and the other one was going to be let go, and she ended up quitting. I think she saw the writing on the wall. And I hired two new employees and two new dental assistants, and they're incredible. And everybody can see. But I'll tell you, I hung on to those employees for like 2 years too long, because I just kept the devil, right? Like, you're
Yes.
just so afraid. What if the other person that comes in is going to be worse than this person? And what if, and I can't pay the other person more money? Like that also has a lot to do with it. Can I really afford someone that's significantly better than what I have today? But the $1 or $2 or the $5 an hour more, wow, changes everything.
Yes. I just want to like life coach into that for a minute.
Go for it.
So I've done so much studying on how the human brain works. And one of the things that brains hate, and I'm talking about like not your individual soul, but like the organ that lives between your ears and behind your eyes, this meat that's back here, it wants you to be safe. And so it hates change. Even if what you have kind of sucks and is stressful, it would rather have the known than the unknown. And so all those little things that you just said, well, I don't know if I can afford somebody better. I don't know, all these reasons not to get rid of the toxic person is the electrical meat that lives in your head trying to stop you from making your life different. Just for biology purposes, like evolution wants things to stay the same. We want to stay in the cave, eat the mushrooms and the centipedes instead of going outside and finding the berries, because we already know the mushrooms aren't gonna like eat us or whatever, like it's in there. And it happens all the time that our brains take us owners for this roller coaster ride where it's trying to stop us from making those steps forward. And when you get a coach like you experienced at Productive Dentist Academy, they were able to kind of like pull you out of that and go, no, listen, use your cerebral cortex. This is fine. We don't have to stay in the scary part of your brain. You are going to be fine. And they gave you new things to think about, new hope. And then that was enough to get you over that hump, that wall of awfulness, we call it, where we have to climb up the hard thing before we can get to the other side where the success lies. And I think that happens to women who own dental practices all the time. Actually, I know it does because I talk to scores of them and we work through that fear and where the fear comes from so that they can make the changes that they want to.
Yeah, change is incredibly difficult. You have you have a specific circuit in your brain.
Yep.
And veering off of that, it's like you're magnetized back into the habit that you had, right? Like there's so many wonderful books out there. Atomic Habits is one of my favorites, where they really talk about change, and you can try and make a change. It's just so incredibly difficult because you just get pulled back.
Your brain likes it the way it was.
Yeah.
And so it just keeps on. It's like trying to create a new path through the snow.
Yeah.
You have to step higher and heavier to make the new path. And then once you've done it 10 or 20 times, it's getting easier, but it's still, you want to go. And what's interesting too is that each of your employees also has a human brain that's doing the exact same thing. They want to stay where it was at the same where before as well. Right. And so you as the leader has to be strong and diligent enough to help them make their own habits, their own new paths through the snow.
The two things that I have discovered that are very difficult but have helped me with change are accountability for myself and those around me, and consistency. And those are extremely difficult to do on your own. And as you're talking about making that path in the snow, I would think that Productive Dentist Academy for my practice was a snowblower.
They're like, here, get out of the way. Let me move this back.
Right. Let me show you. And then you can kind of, I have to be driving the snowblower though. And my team is adding the gas to it. Right. But that's how we kind of made way to that change. And we've just turned our practice around to something entirely different.
Give me an example of a change that you made and how consistency helped you keep the path in the snow the same. If you can't think of one, I've got one as a backup, but I would rather hear from you.
So one of the things that we really struggled with was communication between our clinical team members and our benefit team, right? So writing down the procedures that were completed and then going to check out and making sure that everything is accurate. We really had to work very, very hard to get that right. And this is where those two employees came in, where there's just complete lack of consistency in everything that they were doing. There could be 3 things to do and they would forget to do one of them, even though we had checklists and things like that. And so accountability came in because my benefit team, this was hard to do because it's hard to help, to ask someone to have a confrontational discussion, right? So then my benefit team started holding my clinical team accountable to the route sheet. Okay, you're going to come and you're going to give me a route sheet and it's blank. You're going to go back and you're going to fill it out and then you're going to give it to me, right? So we created consistency. This needed to be done this way. And the accountability came in that I am not accepting the lack of consistency.
Yes.
Right. So, and we're still working on that. We're still not perfect on it. There were a lot of steps. It took us, I want to say, I mean, see, this is where I'm embarrassed to admit that because I want to tell you it took a week. It didn't. It probably took 1.5 years.
Oh, I would believe 1.5 years for sure. Because like we said, it's hard to make those changes. And that's a really, really good example, I think, especially because you aren't involved in that. You're busy,
Right.
you're busy drilling on teeth,
Right.
crowns or whatever. And so you have to be a strong enough leader to reinforce the consistency that they have to give to one another.
Right.
And the
Yeah.
fact
And
that
they
you,
hold me accountable just the same.
yeah,
You know, like, listen, you changed it from an MO to an MOD. You need to tell me to put that on the right, you know, like everybody holds everybody else accountable.
yes. And now also you are supporting your front desk benefits team by providing them with employees who are on the same par that they are. Whereas before, putting up with
Yep.
less desirable ones, these guys in the benefits team had to make up for it every
Yes.
day, which is hard for morale.
Yeah. It is not fair. And when these 2 new assistants came in, who are incredible, who support my 2 other assistants in a way that they hadn't been supported before, my benefit team, like I remember my office manager came to me and she's like, "Oh my God, this is so much better. You have no idea. Like we don't have to go back and forth." So like, and think about 1.5 years of bullshit, of
Yeah.
hanging, of holding on to people that really did not belong with us. What was that doing? That was breaking apart the culture in the back, and I was putting way too much pressure and too much work on the people in the front. I mean, like, like when you think about it, when you think back, it's like no brainer. You should have gotten rid of them, but it just, unfortunately, that change the brain, the circuits, the hope that you have that these people are going to get better and work better, that's really preventing you from making the changes that are necessary for you to grow your business. It's scary.
Don't you think everybody who has a dental practice deserves to have someone on their team that has a snowplow?
Oh, I like that. Yes.
Everybody
That,
deserves that.
yeah.
You're already doing hard stuff. So let someone who owns a plow come through and create a path for you and support you in that way that they already know what to do.
I know you asked me about a change, that was specific to the practice, but I'll tell you the other change that really ignited everything was hiring a life coach. Um, because, and I cannot stress enough. Look, you're going to say life coaches are for suckers. They're for losers. They're for people that don't know where they're going, right? I mean, and I can't afford one, right? I'm not going to pay somebody to tell me something that I already know. But here's the thing, within my first life coaching session with Lonnie Grass, one coaching session, I went back to work and she discovered how I can feel confidence in myself enough that I saw one patient who I had been talking to for years about doing her anterior crowns. And that next day, she committed to it. Why? Because I came into the room being a different person, because Lonnie showed me that there's a confidence that is inside of me, and she helped me unlock it. Right? Within one case, within one day, I paid for more than a year's worth of coaching. So you can argue with me, I don't have the money. Maybe you don't have the money for the snowplow that's either a Productive Dentist Academy or a life coach, but there's such an enormous return on that investment.
Yeah. I mean, I see that all the time. with all of my clients. I
Right.
kind of laugh when I tell them that this investment is going to pay for itself
Yeah.
over and over and
Over
over
and
again.
over.
It's
Yeah.
going to be in the quality of your life, the quality of your practice, and how much money you make, because you won't feel ashamed to suggest ideal care anymore.
Right.
So it's like, it's the best.
Get the snowplow.
I learned to be a life coach like 4 or 5 years ago, and I still have multiple life coaches for myself because I continue to find things that
Yeah.
benefit my life for one reason or another, and it's amazing. Plus, I have a consultant as well. So, like,
Yeah.
yeah. Well, I'm glad we agree on that.
Yeah. Snowplow.
Yeah, I love that. Let's I'll tell this editors to make that the title of this episode. Everybody deserves a snowplow.
Listen, you're going to avoid having a heart attack, right? Because you can get a shovel. And if your cholesterol is a little high, you run the risk of having a heart attack, which is exactly what's going to happen at work if you don't get someone to help you to ease that burden that you're feeling inside of you
Yeah.
by, living an undiscovered life.
Yeah. And it's so fascinating how much you can change in your life simply by looking at things differently. And that is what a life coach and a consultant does. And they are different.
Yeah, it's two completely different things for two completely different reasons. I still continue my life coaching with Lonnie Grass, and we've been with Productive Dentist Academy for 3 years now. So I don't foresee ending either. Every now and again, I'll take a break from life coaching. I've taken one, but I need it. I need it. I need that guidance.
Yeah. How do people find you? Like, if they're fascinated by everything that you're saying and they're like, I need more Maggie. How do they find you?
If you go to Dentistry Today and if you look for mindful moments, I have lots and lots of articles. I've probably published, I don't know, 60, 70 articles in the last 3 years. Not just on Dentistry Today, but in other outlets. But Dentistry Today has most of my articles. And then, of course, social media, Facebook and Instagram. I am way more on Facebook because I'm old than on Instagram. So, just go to Facebook, find Maggie Augustyn and ask to friend me or follow me. Some of my posts are public. Most of them are for friends only. So just find me that way.
Good. We will put that in the show notes if that's okay with you. We'll put your
Perfect. Thank you.
Profile page there. And if you send me a link to your latest article, I'll stick that in too, to Dentistry Today. And thank you so much for your time and your vulnerability.
Of course.
And also now, a little slice of your badassness where you learn these things and you're sharing it with us as we continue to lead and grow our practices. We really appreciate women like you. So thank you.
Right back at you. Thank you very much for all you do in creating the confidence that women have to move forward and find some sort of equality.
Mm-hmm. Yeah, it's important work. All right, we're going to sign off. Thank you so much, Dr. Augustyn.
Thank you.
Thanks for listening to my podcast today. I'm Dr. Laura Mock signing out. Remember, if you want to take that free course on correcting your employees, text the words "love your employees" with no spaces to 66866. Thanks, ladies. See you next time. Thank you for listening to Love Your Practice with Dr. Laura Mock. I would love to meet you. To join our movement, find the Facebook group called Love Your Practice and request to join. If you can't find it, just send me a message and I'll add ya. You'll find me there helping all of my ladies to fall in love with their businesses and have a better life.